This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222. One of the next topics I'd like to talk about is because in my clinic yesterday I saw 2 males with low sperm counts. And what are we going to do about it? Low sperm counts account for probably 20 to 25% of all infertility. Now we're talking, when I say low counts, less than 5 million per mil. The normal sperm count that will give you a normal rate of conception is 15 million plus. And of those, over 30% need to be swimmers. So when you get down to less than 5 million, there is likely to be a significant problem. Investigations of those men are very important. And just moving people on to, you need IVF with sperm injection technique may overcome the problem, but I think it's important to actually define more about the problem and see whether we can actually, without going to IVF, improve the situation. So we start with a simple blood test, which involves looking at your hormones. It involves looking at your genetic makeup, make sure there's no chromosomal abnormality that's causing it. And in more detail, we're looking at specific gene absences called deletions on the male chromosome, the Y chromosome. These microdeletions occur in about 15% of men with counts less than 5 million. There's not much we can do about it, but at least we know the reason why, and wasting time doing other treatments, medical or surgical treatments, it's not going to help you. What we've got to do is, what we've got in terms of sperm is deal with them. When we get down to the level of no sperm whatsoever, we've got to think about whether there's a block between the testicle and the outside world. But in that situation, what we're looking for is whether the testicle is actually producing sperm. Is the production line working? Hormones give us a good indication of that. An ultrasound of the testicle, if the volume of the testicle is of a normal volume, and we can be quite optimistic that there is sperm there. It's just that the body, and there is some obstruction to them getting out. The obstructions can be caused by infection. They can be congenital. There's a relationship between cystic fibrosis, that disease that causes respiratory problems. If you're carrying the gene for that, even the mutation, the single mutation, not the double mutation, there is a relationship with that, and the absence of the vas deferens, the tube that joins the testicle to the penis. And if that's absent, it means that obviously no sperm is going to come out. But what it doesn't do is stop the production of sperm in the testicle. So we can inject the eggs with those sperm, and pregnancy rates are as good as anybody else's. And the last one where we get no sperm is something called retrograde ejaculation, where although you have an orgasm and you produce seminal fluid, the sperm and its seminal fluid, instead of coming out of the penis, gets sent backwards into the bladder. This is very uncommon, usually associated with diabetic men with neurological problems. But it's something we go looking for to make sure that's not a problem, because it's relatively simply overcome. Basically, you ejaculate, and then we get you to urinate, and we find the sperm in there, and we can use those sperm to produce a pregnancy. But that's very rare. The ultrasound that we've done is, in addition to showing that the testicles are the right size, also can show us whether there are any varicose veins around the testicle. Significant varicose veins mean that the testicle is warmed up to a higher temperature than is normal. God made our testicles hang down because the best temperature for sperm production is actually 1.5 degrees less than your body temperature, around 35 degrees. That gives the best production line. that the workers in the testicle in those sort of conditions work their hardest. If you warm them up, they slow down. They get lazy. So when the varicocele are there in significant amounts, that warms the testicle up, slows down the workers in the production line, and that can be a cause of a low sperm count. So doing an ultrasound to exclude that is good, because if we find it, those varicoceles, as they're called, can be either tied off, or we can inject them with basically a clotting system that stops them being there. So there are ways around that. So there's lots of information to gain from the scrotal ultrasound. Ultimately, men who present with no sperm whatsoever, about a third of them will actually end up with a pregnancy, even though on their ejaculate there weren't any sperm. Moving further up, between no sperm and 5 million, something like 75% of couples will end up with a baby. Having low sperm counts is not the end of the world. There's technology, there's treatments, and we can handle all of that in over a period of time.